guys, Dr. Kendi here, and welcome back again to my oral health diaries. I hope you've been following up and keeping up with the dental aesthetics series. We've been discussing tooth discoloration, and now we are about to deal with the elephant in the room when we discuss tooth discoloration, especially in the population in the KE. So today we are going to be discussing dental fluorosis. Now, before we start our discussion, let's give you some time to hit the subscribe button, like, and share the video. Alright, now let's get to the discussion. Today is an exciting episode because we have done an extracurricular. We are now traveling and getting to meet different practitioners who are also passionate about oral health awareness and oral health improvement in the KE. And today we have traveled all the way to Nakuru and we have a specialist joining us on this discussion. We have my colleague and friend, Dr. Maronga. I think I'm going to give him a chance to introduce himself politely, and then I will let you guys know the truth. Dr. Karibu sana.
Thank you.
You can maybe introduce yourself to our viewers, what you do, what you're passionate about.
Yeah. Hi everyone. My name is Dr. Godfrey Maronga. I'm a restorative dentist. And I practice here at SMILEDENT Dental Center in Nakuru. So, karibu sana.
Asante.
Yeah.
Asante. So, Dr. you said you're a restorative dentist.
Yeah.
Initially, we had a maxillofacial surgeon on this platform. So, most of our viewers don't know that there are actually specialties in dentistry. So, as a restorative dentist, what do you focus on? What do you do mostly? Or ulienda kusoma kufanya nini? Haswa. See, my soul is getting good.
Yeah, you're improving. Yeah, that's good. So, restorative dentistry is really about restoring smiles and restoring teeth. So, it has all the components of, if something is not right, the aesthetics, like the series that you're running about aesthetics. If the aesthetics is not good, we restore. If the function is not good, we restore. If anything about the restoration of the smile, the beauty, the function, and the health. That's all about restorative dentistry. So it has to do with the smile and it has to do with the function.
Okay.
Yeah.
Okay.
Yeah.
So basically what we're trying to tell our viewers is teeth. We want to look at teeth as like a car. If it has a problem, you don't throw away your car, you fix it. And that's what restorative dentists are there for. Sometimes when you have a cavity, what else? You have discolored teeth, like what we're about to discuss. When you give them a chance. You give them a chance to be restored. So now, let us discuss dental fluorosis. I have Dr. Maronga here with me because he is very passionate about this topic, and you are going to see why. So maybe we can start with him just explaining to us what dental fluorosis is. What is dental fluorosis?
Okay, dental fluorosis is a developmental anomaly of the teeth, especially, that happens as a result of the teeth very early in development being exposed to a high amount of a mineral called fluoride. So with that excessive fluoride, the teeth don't develop normally the way they should, and so they end up having a condition called dental fluorosis. And dental fluorosis now could be a whole range from being very mild to being very severe. So the reason why really I'm very passionate about it is, as a restorative dentist, I want good teeth to work with. But the moment you have teeth that have been affected by fluorosis, those are not good teeth to work with, and they have a whole array of problems.
Yeah.
So that's why even as we are restoring, we are also very passionate about prevention.
Okay.
Yeah.
Okay.
Yeah.
You have mentioned that dental fluorosis is a developmental issue that affects the teeth early.
Yes.
So can you tell us from what point to what point are we vulnerable to dental fluorosis?
All the way, you see, fluoride as a mineral affects the teeth all the way from the time the teeth start developing. It might interest you to know that teeth actually start developing 6 weeks after conception.
Intrauterine. So a pregnant lady at 6 weeks.
Yes. And this goes all the way, some people would say 8 years. So that's when teeth are still developing.
Yeah.
But I would take it to 10 years because, as you know, development is not like very specific. It's a range. It's a range.
Yeah.
So I would say up to children who are up to, so from the time of conception up to the time of like 10 years.
Okay.
Those teeth are vulnerable to developing fluorosis.
Okay.
Yeah.
Okay, so these teeth are vulnerable to developing fluorosis at that time because of the fluoride intake.
Yes.
So where does this fluoride come from?
Now, fluoride is all over. It's in the soil, it's in the water. So anything that is going to end up in the human body, be it the food that is cooked, and this is what I find most people really don't appreciate.
Yeah, they ignore that.
They'll tell you daktari maji ya kupika hiyo tunatumia ya tap, but ya kunywa tunanunua. So you see, at the end of the day, whether it's water that you are using in preparing your food, whether it's water that you are using to drink, that water still ends in the body. So a lot of times you'll find that it's from the food, it's from the water. Yeah, that's the main sources. Sometimes also children can eat toothpaste. They shouldn't actually ingest toothpaste.
Yes.
So that's also another possible source of fluoride into the body. Yeah.
Yes. Please, viewers, do not allow your children to eat toothpaste. Toothpaste is not food. Whatever is inside toothpaste is not healthy. It could actually be quite hazardous, and you will understand why as we are continuing with this discussion. So, we have said fluorosis is caused by an excessive amount of fluoride.
Yes.
What is the normal level of fluoride that we should have? And when it's normal, what does it do in the body? Is it important?
Yes. Now, this fluoride is just one of the macro, elements that are essential. Really, there is no very specific, you can say, but it's just one of the macro elements that are present in the environment and also in the human body are required. But the problem is when it's excessive now. So the required amount is the recommended amount. This has been established by the WHO, and we also have the East African standard. We say it's 1 part per million of water. So it shouldn't go beyond that. When it's going beyond 1.5 parts per million, then that is excessive. Yeah, so that's the recommended level.
Okay.
Yeah.
Of intake.
Of intake, yes.
All right.
Yeah.
So with fluoride, I think our viewers should get to understand that there's a difference between the fluoride we are taking in and the fluoride that is applied onto surfaces, like on tooth surfaces.
Yes.
Can we talk about, like, kind of differentiate the use of fluoride that we take in and the use of fluoride that we apply? Maybe you can start with the one that we take in and then the...
Yeah, that's a very good aspect that you bring, because I've seen some people online say that they want to have fluoride that is toothpaste that is fluoride free. So there are two different types of fluoride, as you mentioned.
Yes.
And this depends on how do we take it in, or how do we interact with it. There is the fluoride that you take into the body, the systemic fluoride.
Yes.
That's the one we are saying it shouldn't go beyond 1.5 parts per million in the water that we use for cooking and drinking. So that is systemic fluoride. But there is topical fluoride, and topical just means on the surface, especially on the surface of the teeth. Yes. Now we want topical fluoride on the surfaces of our teeth so that we make the teeth resistant to tooth decay, what is commonly called dental caries. So it's different. So you shouldn't say, I want fluoride, toothpaste that is fluoride free, because you need the topical fluoride. Yes.
Okay.
Yes, so that's the difference.
All right.
Yeah.
With regards to the topical fluoride,
yes.
Is there a recommended, because patients will ask, can you recommend a toothpaste for me?
Yeah.
Do you have any comments with regards to that?
The average recommendation, the commonly used toothpastes are usually up to 1,000 parts per million, I guess, 1,000 parts per million, which is relatively high compared to the systemic one. That's high. But even in some cases, we have systemic preparations, topical preparations of fluoride for somebody to actually, for a dentist to apply
professionally
to prevent. And sometimes you even have some toothpastes that even have a high amount than that, depending on the caries risk of the specific patient. How vulnerable are they to tooth decay? So you could recommend application of a higher amount of a fluoride, but this is on the surface, this is topical, this is not for systemic consumption.
Okay.
Yeah.
Okay.
Yeah.
We have had a discussion on this platform encouraging our viewers to have biannual visits to the dentist to get fluoride application.
Yeah.
They were a bit not so sure, but you know, now that I have someone else on this platform, I think I can reiterate that message about topical fluoride application. You have mentioned that these patients who we do topical fluoride application for are patients who have high risk of caries. Could you please explain to us how you assess how a patient has a caries risk, or what should they look at? What do you look at as a restorative dentist to decide this patient is high risk and this patient is low risk?
The main thing, there are a number of factors that you look at. There is diet, so you do diet charts, especially when you pick up patients who have a lot of cavities, but I'll come to that. So you look at the dietary habits. There are people who have what you call a sweet tooth. So you know, sugar, that predisposes you to decay, because tooth decay is really a function of sugar, the tooth surface, time, and the bacteria that ferment that sugar to produce the weak acids that cause decay. So if you have a patient who has frequent or a snacking habit, that puts them in the risk, the high risk category. Then you look at the tooth surface. Some people will have teeth that, you know, don't have any what we call deep fissures. I don't know if we have any. Yeah, we have. So when you have a tooth surface, if somebody were to look at, there are those who do not have very deep pits and fissures, and these ones are not so vulnerable to decay. But there are those who have very deep fissures, and these are the possible areas where tooth decay could actually start. So you look at the tooth surface, and then you also look at the caries activity. You will find somebody who has, somebody is 10 years old and they already have 3 or 4 or 5 teeth that are already having cavities, have some that have already been filled, so this puts them in the high caries category. There are also some systemic factors which I think you have mentioned previously, people who have low saliva flow, you know, and all the other factors that could predispose them to caries. So those are high caries risk. So a patient can either be said to be high caries risk or low caries risk. But your dentist will be able to evaluate and determine where you fall. Yeah.
All right.
Yeah.
Awesome. As we continue with this discussion, for me, I feel like the question I have been asked a lot by most parents is, my children, maybe they have 3 or 5 children.
Yes.
Let's be a bit generous. Let's say 5. So they have 5 children, yeah? But maybe 1 out of those 5 has been affected by dental fluorosis. And then they ask, you know, what could have caused this particular child to get dental fluorosis while I have exposed all of these children to the same? Are there any other factors that come into play apart from the high concentration of fluoride?
Yes, you see, at the end of the day, if both me and you are exposed to, so there has to be the exposure to high content of fluoride.
Basic,
But then how the body actually metabolizes the fluoride element will determine whether this child will develop the fluorosis or not. Yeah, so it's the same thing. If you get 2 people and expose them to, say, a high fat content, there is a person who will probably gain weight and the other one will not. So it has to do with the genetic makeup and how the metabolism of the body is as relates to this fluoride element. But some of those are factors that you really cannot control.
Yes.
The genetic makeup and everything. So really what we can do is to advise about the exposure. So let's control the exposure because that is in our control.
Okay.
Yeah.
All right.
Yeah.
So we've had a lot of discussions, I think, on platforms about dental fluorosis in Kenya.
Yeah.
Are there any particular reasons why there is a very high fluoride content in the water in Kenya?
Yes, it all has to do with the aquifer or the subsurface rocks where the water comes from. There are a lot of studies that have been done, and I was privileged to have collaborated in a study with a Kenyan who was doing his master's in medical geology from the University of Joburg, and he did quite a bit of research around here. And what he established is that more than, I think, 70 or 80% of the aquifers had a high content of the mineral fluoride. So every time you get water from the surface or the subsurface, you will, many times you will end up, there is a high chance that you will get water that is high in fluoride. And I think it has to do with the volcanic activity, the Rift Valley, and all that, which really is now geology and something.
So other than dental fluorosis, that is of course our area of specialty, the teeth, is there any other effect that a high fluoride level could have to the human body?
Yes. Remember, fluoride has a very high affinity for the dental, not the dental, but the body's hard tissues. So the hard tissues we are talking about are teeth and bones. Now, the threshold or the level of exposure to fluoride that will cause dental fluorosis is usually lower. But if you go like to these areas of Baringo, there is a very high fluoride content. Now that will affect the skeleton. And some people end up with what is called skeletal fluorosis. So there is dental fluorosis affecting the teeth, but there is skeletal fluorosis affecting the skeleton. And how that will, if you have a minute, maybe I will say how that will present, is what happens is the mineral fluoride gets incorporated into the bone. So these bones tend to become very hard. And you know, the bone should be a bit pliable, not very stiff and hard, because something that is stiff and hard will usually tend to fracture when exposed to forces. So you will get that these people will tend to have what we call pathological fractures, and they will have skeletal deformities. So yes, it can affect the teeth, but it can also affect the skeleton as well. Now there are some studies that have been done that have shown that a high fluoride content can even affect the IQ and everything. I'll just leave that topic out. I think I'll leave that to developmental specialists to talk about.
But I've also heard of those studies being done, and it's quite an interesting topic. But let's continue with our focus for today. Maybe we should have another session to discuss that. So maybe Dr. you can explain to our viewers what is the typical presentation of dental fluorosis. How would it look like?
Maybe to answer that, I'll just take you a step back. So what happens, the way I would want to put it in a very simple way, because we are talking to not doctors mainly, but just to common public. What happens is, think about the cells that lay down the hard tissues, that's the enamel and dentine, like a machine that is stitching, bringing together the cells. But what tends to happen is that when there is excessive fluoride, is like they are toxic or they are poisonous to these cells. So these cells, instead of laying down the layers of enamel and dentine nicely, will tend to have areas where they have not laid down the enamel. So you have spaces. And this is what we call in technical terms the subsurface porosities that happen in the enamel. Now when the child is born, now that's about the presentation, when the permanent teeth start coming in, because mainly there are some studies that have shown that even fluoride can affect even the milk teeth, but mainly we see it in the permanent teeth. So how this will present is, you will find when the children are born, the teeth look chalky white, when the permanent teeth start coming in, so they look chalky white. So they are not the creamy white. I know you will be talking about tooth curl and everything. So they are not the creamy white that you see, but you will see chalky white. So over time, then these teeth start to pick up stains. And now that's when parents start getting concerned. But the problem actually started happening a long time back. So they present as staining. If it's mild, some bands of spots or stains on the teeth. But if it's severe, because it's a scale depending on the amount of exposure to fluoride, they could even actually have pitting like you have holes ditching a very uneven rough surface that is dark on the tooth, and now that is now severe fluorosis. And unfortunately, management is usually something that is very, very difficult to do, especially for young children. Yeah.
Okay.
Yeah.
Other than the aesthetic concern that dental fluorosis causes, are there any other salient features that come about as a result of fluorosis? The teeth are discolored, they're not looking so nice, but what else could happen?
Now, the biggest thing that we have seen, especially, has to do with the psychological effect, mainly, of the children. The children will be given names by their friends or their peers. And you know, like here in Nakuru, when the children are many, it's not an issue. But when these children step out and people look at them differently, that tends to affect them psychologically. It will affect their performance in school. It will affect how they interact with the other children. So there is the psychological impact. But I also have tons and tons of pictures here where these teeth, because they are uneven, rough and all that, they tend to accumulate a lot of plaque. And plaque, as you have pointed out in your previous episodes, is what really contributes to tooth decay. So these teeth are more vulnerable to tooth decay, and also now the aesthetics issue, and also the psychological issue. So now when you have children whose teeth are decayed and all that, now it has all the other effects. These children will miss school to go see the dentist, you know, all that. So ultimately this has a huge impact on the children's oral health and even psychological well-being. So
the best thing to do for dental fluorosis would be, what would you recommend?
I think you have your answer. Yes, if we can prevent.
Yes.
Prevention is really the main thing. And prevention is, you know, they say prevention is better than cure. It's far much cheaper, you know. But how do we get ourselves here? I'll tell you why we have reached where we have reached. Every time you talk about prevention, you are almost saying about like taking insurance. You know, you really don't get the tangible benefit. It's not visible immediately. It's something that is long term. And we are in a society where we all want, you know, something that you can hold on to and see. But this is a long-term thing. So prevention is really the way to go. So we do education. We educate people how to prevent fluorosis. And even the children themselves, they are told, this is the safe source of water, don't drink this, use this. We have whatever it takes to you know, remove the fluoride from the water, so that we have safe cooking and drinking water. The plants that grow out there, you know, they also get the water anyway, but the amount might not be as much to cause an issue of the magnitude we are seeing. So prevention really is the main thing.
Awesome. This discussion has been really nice, very enlightening. Of course, we're going to continue carrying forward the discussion and discussing prevention. Doc has put it very clearly. The best way to deal with dental fluorosis is prevention. So thank you so much for joining us on this episode. We will request you to join us for a few more others as we continue discussing. Make sure you keep, you know, you're subscribed and you keep linked in so that you don't miss out any session. On the next episode, we'll be focusing on prevention of dental fluorosis. But I hope you learned something today. And thank you for joining us on this week's episode of My Oral Health Diaries. I'll see you guys again next week. Production team, this I would like to address to the Kenyan nation. Niangalie wapi?
That was nice.
That was very nice, Daktari. It's like you were very prepared. Wait. I hope you've caught up on the previous episodes. We are still on our... I'm sorry. Gosh, mnaweza sema hivyo.